Hello everybody. Today we're going to talk about whiplash and neck injury. Each year, more than 2 million Americans experience a whiplash injury, also known as a whiplash-associated disorder, to the area of the neck. Numerous studies have shown that the most common cause of whiplash is a 6 to 12 mile per hour rear-end automobile collision, where the individual has a sudden hyperextension, which is a backward movement, and flexion, which is a forward movement, injury to the neck. This violent, unexpected motion forces the neuromuscular structure of the cervical region to exceed its normal movement parameters. Collisions at higher speeds have a commensurately higher incidence of severe damage to the cervical spine region. Whiplash-associated disorder can also be caused by a front-end or side impact automobile collision. They can also be caused by contact sport-related accidents, such as being struck from behind, diving or swimming pool accidents, amusement park rides, or physical abuse, as is seen in shaken baby syndrome. The pain the individual feels can be mild to severe and acute or short-term or chronic or long-term. It's generally agreed that as many as 40% of patients with acute whiplash-associated neck pain will go on to develop chronic neck pain. In the majority of cases, the whiplash injury damages the soft tissue of the neck, resulting in a sprain or a strain of the neck muscles and ligaments. In the past, damage to the soft tissues was nearly impossible to visualize, even with the aid of advanced various imaging technologies such as MRI, CT scan, standard X-ray with contrast, etc. Visualization remains difficult. Cervical flexion and extension films may at times reveal some instability, which will help with some of the diagnosis of the pain. There are times when patients will experience soft tissue injury with pain, yet the imaging studies are completely normal. This means that the key factor in soft tissue diagnosis is the knowledge and experience of the spine specialist. The symptoms of a soft tissue neck injury include neck pain, arm and hand pain, stiffness, back pain, shoulder pain, ringing in the ears, dizziness, neck-related or cervicogenic headaches, paresthesias to the arms such as burning, tingling, or prickling sensation, or injury to the discs in the neck as well as the low back, injury to the facet joints of the low back and the sacroiliac joints. Some people may also experience cognitive deficits such as memory loss and impaired concentration, as well as sleep disorders or psychological conditions such as nervousness, depression, or irritability. It's important to keep in mind that while the symptoms of a whiplash-associated disorder usually appear within 24 hours, in some cases, the symptoms may not manifest themselves until days or even weeks after the accident. If a soft tissue injury is confirmed, there are a number of passive treatment alternatives that may be considered and recommended, including bed rest, hot and cold compresses, pain-relieving medications such as non-steroidal anti-inflammatory medications, and muscle relaxants. The decision as to which medication is prescribed will depend on the type and severity of pain being experienced, the individual's pain tolerance, and their general medical condition. Spine specialists now prefer that the patient pursue their daily activities in as normal a manner as possible. In the past, whiplash patients were advised to wear a cervical collar to limit neck movement. This type of immobilization is no longer considered as an effective therapy, as prolonged collar wear can cause weakness in the neck muscles. Most patients with mild to moderate whiplash will have pain relief within a few days to 2 weeks, with a prognosis of full recovery in about 10 to 12 weeks. For those individuals whose neck pain becomes chronic, which is more than about 12 weeks, or worsens, the spine specialist may recommend, in addition to pain medication, some form of active intervention, including physical medicine, physical therapy, conservative chiropractic treatment, traction, range of motion exercises, etc. In the rare case of prolonged debilitating soft tissue pain, the patient may be prescribed anti-inflammatory medications, cortisone injections, opioid analgesics, and antidepressants, as well as epidural steroid injections. Surgery is generally not considered to be a treatment option for a soft tissue whiplash-associated disorder. The pain symptoms of a cervical spine injury due to whiplash-associated disorder are similar to that of a soft tissue injury. If the spine specialist's examination and imaging studies reveals damage to the facet joints, intervertebral discs, nerve roots, and or vertebra of the cervical spine, a more aggressive treatment regimen is usually undertaken. This approach may include physical therapy, physical medicine, anti-inflammatory pain medications, injections of cortisone into the facet joints, facet blocks, radiofrequency rhizotomy lesions, as well as therapeutic nerve blocks, epidural steroid injections, and the possibility of surgical intervention, including anterior cervical discectomy with fusion or laminectomy with fusion. In summary, whiplash injuries to the cervical spine can be very debilitating. They can be short-term or long-term. It's sometimes difficult to establish an exact diagnosis purely based on imaging studies. For this reason, the success of whiplash treatment will be a function of the thoroughness and accuracy of the spine specialist's diagnosis. If you would like to have a question answered by Dr. Kraus, just complete the form at www.spinehealth.com/contact-us.php. In the contact form, you'll notice a box requesting insurance. In this box, just simply type Ask Dr. Kraus. Thank you very much for listening, and we look forward to seeing you soon next time.